Hi everyone, I'm Dr. Amir Karam, board-certified facial plastic surgeon and founder and creator of Karam MD Skin. I specialize in facial rejuvenation, which basically means I help people look as young as they feel. I welcome you to today's episode of Skin School, where we're going to talk about a topic that I think is very important to communicate and for you to understand if you're serious about anti-aging skincare and what you can do to not only prevent but restore your skin. Because at the center of it all comes down a very simple principle, which I'll reiterate over and over again. What makes skin look better over time is being conscious and aware of what you put on it in terms of active ingredients that are effective, in addition to sun protection. So let's just keep that principle and frame of mind as we go forward. Today, we're gonna highlight one of the most important players in skincare, and that is topical vitamin C. Topical vitamin C over years and decades have picked up so much clinical science and clinical research that has shown its importance as sort of a multifaceted and very important part of treating the different components of skin aging that I've personally felt as a creator of the skincare product to include it as a second step of a three-step routine called the trifecta, because it is so important if we're gonna be really deliberate and serious about managing the aging skin. And I'm going to talk to you in this video about what exactly topical vitamin C does, how it differs than oral vitamin C that you take, but also really delve into the science of what's happening at the cellular level inside the dermis of the skin when topical vitamin C is added to it. In addition, we'll just talk about the overall benefits of it so you know what to expect, the transformation and the changes that you're going to see in your skin when you start to use vitamin C over the months and years to come, and also the importance of pairing vitamin C with certain other active ingredients and an all-around good skincare lifestyle. Anti-aging skincare lifestyle, I should say. Ultimately, I want to basically bring this in and put vitamin C in the context of oral versus topical so you understand the importance and relevance of each of those. Skin, as you know, ages in a very complex way. So there's changes that happen to the pigmentation, right? You see sunspots happening as many people who are in their 40s and 50s today lived a lifestyle when they're in their teens and 20s, were really baking in the sun, getting those beautiful tans. But when they get older, you start to see the consequences of those actions. So sun damage is a very important part that not only results in pigmentation, but it also causes the loss of collagen. And collagen is what basically makes up the entire dermis of the cell from like a structural perspective. So once you start to lose collagen, what you start to see is the skin starts to become frail, weak, and wrinkled. So fine lines and wrinkles come from that. Now, in addition to the impact from sun, just normal skin aging begins to see the loss of collagen. So basically starting in our 20s and 30s, there is a slow but consistent decrease in the production of collagen at the cellular level, which is leading to the thinning of the skin, coarse wrinkles, fine lines, and the textural things that you see when you think about aged-looking skin. Having said that, that's a very important aspect of it. Now, there's other things that are happening to the skin, right? There's changes in hydration, skin becomes more dry, it becomes a little bit more dull. And what's also happening is it's exposed. The skin is on our outer surface of our body, so it's constantly getting exposed to airborne pollutants as well as internal toxins that we take as part of our diet or just basic cellular metabolism. So all of those things, compounding effects, start to cause the skin to age. In some cases more rapidly, depending on the exposure to these things, like sun is a massive contributor to skin aging, but at the end of the day, these are the combination of changes that are happening simultaneously. So what we always think about, and especially from my point of view as somebody who's trying to produce and create skincare products that are basically doing something meaningful and real to the skin, I'm thinking about how do we address all of these different things that are happening at the skin simultaneously? How are we going to make a comprehensive impact on those changes all at once? And what's interesting is vitamin C hits almost all of those things. vitamin C as a molecule, as an active, one of the key components that it does is it's an antioxidant. And what antioxidants will do is think about it as like a sponge that goes up and soaks up free radicals that damage the skin and the DNA and all the other kind of components of the skin. So sun is a massive generator of free radicals within the skin, and the presence of vitamin C is something that will give the protection, right? So that's a huge aspect of it. The other component of it is what's happening at the cellular level, which we're going to go into in a little bit more depth, but just know this as just an overall benefit, that people who use vitamin C on their skin, in studies that have been done over weeks, months, and even up to a year, show that the skin pigmentation decreases with time, and I'm going to explain the science behind that. You see that fine lines and coarse wrinkles improve with time. You see that the skin ultimately, in some cases, will look even more hydrated and more bright as a result of it. And the overall aspect of the skin from a redness perspective, and even in patients who have acne or inflammation as a result of acne, they see those improve. So there's a lot of different things that are happening from a skin benefit point of view that vitamin C is impacting. But to summarize this, we're thinking about vitamin C as helping with fine lines and wrinkles. We're talking about discoloration, and we're talking about just the overall look and feel of the skin. But keep in mind, this is not something that you use as a magic bullet for a week and you're done. These studies all show these changes that are happening over time, and over time means that months and years, the skin just gets better, 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 and better. In fact, our own clinical studies that we performed on the trifecta showed that skin made major improvements from baseline, 0, 4 weeks, and 8 weeks. So that trend of constant improvement comes from the consistency and the use of product over time. All right, so let's talk about the benefits at the cellular level. Now, I've already alluded to one of the biggest ones, which is the antioxidant impact, right? The soaking up of these free radicals that cause all sorts of damage to the skin, including sun damage, all those other things, but also DNA damage as well. So the antioxidant effect and the soaking up of the free radicals is huge. That's number one. Number two, what happens is at the cellular level, we're talking about the dermis has certain cells inside of it, primarily called fibroblasts. Those are the main skin dermal cells, right? Those are the skin cells. And what fibroblasts do is they produce collagen. Now, this is something I want you to really, really put into your mind and really think about for a second. So as we age, and I'm talking about from like 20 and beyond, skin collagen production begins to decrease. That's what the fibroblasts are actually doing. They're just starting to get lazy and starting to decrease their production of that beautiful and important product of the synthesis called collagen, which makes the dermis thick. On the other side of it, when you experiment and you look at skin as skin actually ages, you see that young people have thicker skin and older people have thinner dermises. So thicker dermis during youth and thinner dermises during aging. And that's because the collagen production shrinks, and as a result, the skin shrinks. And when the skin shrinks, that suppleness, that fullness, that vitality of the skin begins to diminish. And I've already mentioned earlier what those factors are, but what's important is that the fibroblasts are not working as hard as they should if we want to have that youthful, beautiful skin with age. Now, how is vitamin C impacting that? At the cellular level, at the fibroblast level, it stimulates them. It helps them basically turn on the machinery that produces collagen. And that collagen production is extremely important for every aspect of skin aging from an appearance point of view, that we increase the production of collagen year after year as opposed to decrease it. I cannot stress this enough, that this is the foundation of skin looking more youthful. This is the foundation of why you want to avoid as much sun on your facial skin as possible, because all that sun is further diminishing collagen, is breaking down collagen. In addition to the inherent reduction, now you're getting a double whammy. So when you're using vitamin C, you're also improving sun protection through the antioxidant effect, but you're also stimulating collagen production, which is huge. For me, as a facial surgeon, where I'm repositioning the face and putting things back into position, when you have a really supple and thick skin envelope, man, do the results look 10 times better. So this is really important to me, and this is actually one of the major reasons why I developed the trifecta to be so easy, so that people can use this over time, because this is all about consistency over time. This is not a short-term jump around from skincare product to skincare product. What I'm explaining here is something that you need to include in your skincare lifestyle, this type of treatment, for the rest of your life, as long as you care about your skin. So collagen production is huge. Number 3 is pigmentation. What is a pigment? Pigment is melanin that's produced by another cell that's inside the dermis called melanocytes. We all have different amounts of melanin. Like I have a certain amount of melanin relative to somebody who's from Eastern Europe who has a very little amount of melanin. But at the end of the day, what happens is sun over time stimulates melanocytes to produce melanin. It's basically what a tan is. But what happens is that all that impact that happens, all that damage that happens over time, and all that sun that's absorbed by these melanocytes, as we age, as time goes on, what happens is it starts to release melanin into the dermis. And what happens is you start to see these little freckles forming that lead to plaques of sun damage, discoloration, and that what we call hyperpigmentation, discoloration. All of that is fundamentally what sun damage looks like on the skin. It stops you from having an even tone to your skin to having blotchiness to your skin. And what vitamin C does is it works at the cellular level, at the level of the melanocyte, and it decreases and inhibits a very important enzyme that will then transform that will basically produce melanin. It inhibits that, so melanin is unable to be performed at the rate that it normally would be performed. Therefore, it's shutting down the factories the melanin require, and as a result, you get less melanin to the surface, and sunspots start to fade as time goes on. More importantly, and this is something to keep in mind, if you're somebody who likes to get lasers, like for example IPLs or chemical peels, etc., and you wipe away some of the pigment, well, as long as the melanocyte is free to produce melanin, guess what? You're just going to continue to build more melanin, more sunspots. The second the peels are done or the IPL is over, you're going to produce more. And that's why you end up requiring to do this over and over again. Now, the smart way to do it, using science and understanding, the smart way to do it is you clear everything with your lasers or your chemical peel or whatever, and then you suppress the melanocytes from forming melanin. So now all of a sudden, you've cleared the pigments and you're decreasing the production going forward. So now you have clear skin for much longer or potentially forever if you continue using the right active ingredients to suppress melanin. So that's a huge one. So when you take those two fundamental changes at the cellular level together, what you're seeing is skin is going to look more even from a tone point of view. It's going to have less fine lines and wrinkles because of the collagen production that happens. But also there's a hydrating effect that is felt to occur also with vitamin C. And that hydration effect also plumps up the cell and decreases the production of fine lines and wrinkles as well. And an all-around brightening effect, which is not as clinically studied and understood why it happens, but certainly something that people notice when they've been on vitamin C serums for a long time. But the core science is what's happening. It's suppression of melanin and stimulation of collagen. So understand this and keep this in mind, because this is really anti-aging 101, skin looking better every month of your life going forward. And that's what this is all about. All right, so let's talk about good skincare habits and what you need to do in addition to using vitamin C. So basically, we said vitamin C is this multifaceted, beautiful active ingredient. It works in synergy with retinols, right? So retinols do much of the same things as vitamin C does. It's a stimulator of collagen. It decreases pigmentation, but in a different way. It's a very, very foundational and very important part of it. I strongly recommend the use of retinol in addition to vitamin C. I know there's a lot of confusion out there about should you use them together. You absolutely should, but obviously it depends on the type of vitamin C and the type of retinol. A lot of times using them together in certain differing brands can create sensitivities and create a lot of sensitivity to the skin and just make it harsh on the skin. When I developed the trifecta and specifically Illuminate, I made sure that there was synergy and a compatibility between the vitamin C and the retinol. And one of the important aspects of this is that we used it in a time-released, microencapsulated retinol, so it doesn't hit the skin all at once. and the vitamin C is broken up into two parts, so you're using it AM and PM, so that you can tolerate the combined use of vitamin C and retinols together without creating all the sensitivities and harshness that comes with it. Additionally, a particular category of hydroquinone and non-hydroquinone skin lighteners are also involved in basically exactly the same concept that we talked about in inhibiting the production of melanin. And when you use that in addition, now you're getting even more diminishment of the production of melanin. So lighteners in the hydroquinone category, which is a prescription base, in the non-hydroquinone, they're often botanical, but they have that impact on suppression of melanocytes, retinols, and vitamin C. But in addition to all of that, there's a number of other active ingredients, many of which there's just too many to explain, but let's just say that things that are going to improve the hydration of the skin, they're going to brighten it, they're going to improve the cell turnover. All these other things that are important in the long run for improving skin are also kind of key. But I would say if there's 1, 2, or 3 things that you need to make sure you're on is the ones that I'm mentioning right now. What we did with Illuminate is we basically put them all into one bottle, so no one has to think about it and go grab them all off the different shelves, but basically just, in a brainless way, just put it all together and make it very simple to use. But all of these things work in synergy from an anti-aging point of view, but the key is consistency. Now, everything that I'm saying right here, I want to preface it simply by saying you must have good skin anti-aging habits. And what does that mean? So number 1, sun protection is paramount. A good mineral-based sunscreen that has zinc or titanium oxide is very important, because as long as your skin's absorbing all that sun, you're basically treading water. You're taking a few steps forward, a few steps back, and you're not getting anywhere. Protect your skin against the sun. Be very mindful about using sunscreen when you go out and about, in the sun especially, but in just general, make it a habit of you leave the house, you put your sunscreen on. Do that and reapply it, especially if you're out a lot. Your skin will be protected, so then the active ingredients can get some headway and make strides and make improvements. That's really, really important. Other components that are super important for skin is not smoking. That's huge. Limiting, just all around toxins and everything else. Just a healthy, clean diet is really important. I'm going to explain where vitamin C in your diet comes into play, but you certainly need a good amount of protein in your diet, because what is collagen? Collagen is a protein. What are the components of collagen production? Guess what? Protein, amino acids. They're building blocks of protein. So if you're not getting enough protein in your diet and you're trying to stimulate collagen topically, well, guess what? Your skin cells aren't able to compose and build these collagen fibrils, and you're kind of getting nowhere with it, right? You're stimulating, but you don't have the building blocks and material to do it. That's really important. And just keep that in mind as I go back and talk about vitamin C and where that fits into the collagen production part of it. But you need a good diet that has, a good, well-rounded amount of vitamins and minerals, as well as protein. Hydration is really important. Hydration is what your skin is going to take to be able to look as supple and full as possible. Now, but here's the issue. You don't need to be overhydrated, and you certainly aren't going to see the difference between non-optimally hydrated versus perfectly hydrated. It's not that close of a relationship. But if you're dehydrated, you're certainly going to see it in your skin. Other really important aspects are simply sleep. Sleep is a huge part of good skin hygiene and good skin health. Now, having said that component about lifestyle, let's talk about oral vitamin C and how that fits into it. Topical vitamin C works by getting absorbed into the skin cell and working at the dermal layer. And let me just say something about absorption. When we formulated Quench, our vitamin C, we made sure that we were using different types of vitamin C, some of which can absorb through water, some of them absorb through fat, because cells have a cell membrane that are made of fat, and you need a fat-soluble molecule to get into the cell. So these are all very important kind of things to keep in mind. So Quench is a combination of both of those, so it gets high absorption into the skin, into the cell, and starts to be able to help on the DNA level and stimulate what needs to be stimulated. Absorption is really important topically, but if you take oral vitamin C, you're not going to get that same effect that we're talking about in this situation. But oral vitamin C is very, very important, because when collagen is being produced, the amino acids coming together, an important step in collagen synthesis is vitamin C. So you need vitamin C in your diet to be able to get the job done. You also need zinc and you also need copper. So these are all things that you want to get in your diet in a good, basic, well-rounded diet, but be conscious that you're getting some citrus into your diet because you need it. Oral vitamin C has also been shown in general to improve fine lines and wrinkles. No one really quite understands how this, but I bet you it has to do with exactly this pathway that I'm describing. So how often are you supposed to use vitamin C? Again, depending on the brands that you choose. And I always say, this is about information, it's about empowerment. You go out and do your homework and do your research. I can't go through all the different brands that are out there, each of them having different directions. Generally speaking, vitamin C is used once or twice a day, depending on the brand again, depending on the concentrations of the vitamin C and the type of vitamin C that's used. Do your homework, make sure you're comfortable and you trust the brand that you're using, because at the end of the day, you certainly don't want to use something that's not going to be efficacious. Second thing is the bottling and the packaging matters. Vitamin C in the ascorbic acid form is not as stable as you think. If it gets exposed to sunlight, it starts to lose its efficacy. So you don't want to have a bottle that is sitting next to sun that is, opaque or clear and it has vitamin C in it. Most reputable manufacturers don't produce it that way. Like in ours, it's a black bottle, it's dark. UV protection, etc. Also, some forms are more sensitive to air. Air can be an issue and something, so always make sure you tighten the lid if you're using a dropper form or it comes in a airless container. These are all important components with it as well. But you use it consistently once or twice a day, depending on the packaging, and you will see your skin slowly but surely get better over time. Make sure this is part of your normal routine. All right, guys, that is Vitamin C 101. I think I covered everything there is to know about vitamin C, and I think if I haven't already, I hope, at the end of this, you are convinced the importance of vitamin C in your routine, because it is absolutely essential for the reasons we discussed above. Let me know if you have any questions, drop them in the comments below. Make sure you subscribe to the channel if you like this type of material. We're gonna be doing it often, as well as just overall facial rejuvenation and surgical and non-surgical topics. So subscribe to the channel, and very importantly, send this to a friend. Let's get the word out, and knowledge is power, and help everyone arrive at the best decisions they can for their anti-aging needs. All right, everyone, it's been a pleasure. Thanks so much. Until the next episode of Skin School, Dr. Amir Karam.